I'm a big believer in fate. And, one door closes, another one opens. I got very lucky in that respect. I had this hidden angel that was guiding me in ways I didn't appreciate. I got into ENT and I was originally doing what we call skull-base surgery, which is tumors between the brain and the head and neck area. Orbits, ears, nose, all that area. Patients were coming in and saying, you know what? Thank you very much. My wife said I stopped snoring. It wasn't the intention of the surgery at all. It was for sinus issues, but we started looking at this airway component. If you want to improve the airway, you got to follow the airflow. Prior to 2009, which is not that long ago, if you were to ask anybody how air flows through the nose, they really couldn't tell you. The airflow goes through the nose in an arc. It doesn't go straight through. The airflow goes superior. It goes right between your eyes. That's where the maximum airflow goes. So if you follow the airflow, you realize where you have to go with targeted directed surgery. It's minimal surgery, it's targeted surgery, it's anatomically correct surgery, and it's very safe because of that. You're not making these big holes, you're not tearing tissues out, etc. Without a CBCT, it can be any CT of the sinus. You cannot sit in front of a patient and say, here's your problem. And CBCT is extremely low radiation exposure, which is why it's great technology. You get to see so much more of what the issue is with the child, what's causing all the ortho issues that you're seeing, the dental issues, by looking at the whole airway. When you're a mouth breather and you're 6 years old, you can't eat right because you can't breathe through your nose. You have to breathe through your mouth, and you can't eat if you breathe through your mouth, right? No one knows how long it takes to develop ADHD from that exposure during the night.
Right.
How much cortisol, how much adrenaline, how many days, how many nights. The standard of care right now is that you don't operate on the sinuses for airway. The golden rule has always been previously, never operate on anybody under age 16. If you say, wait till they're 15, 16, which is when the involution really maximizes, the damage is done. It's not a very academically solid argument to say they're going to outgrow the problem. They outgrow the lymphoid hypertrophy. The problem is the craniofacial growth restriction, which once you have it, that's when you have a problem for life. The problem doesn't lie so much with the doctors now not believing it. It's the system that's against the doctors who even want to try. We're solid because education is solid. It's one of the real albatrosses around academic medicine is that inability to change a paradigm when it needs to be changed.